Hi, good morning, everyone. Another day that we're going live on Eat to Focus Q&A sections. Um, okay, I'm just looking at something funny on Facebook here, I think. I hope I'm doing everything okay. But anyway, it's all trial and error. Everything will be fine and perfect. Sorry, a bit late here. I'm trying to get myself all comfortable here so I can speak easily and comfortably to all you guys. And hi, so I'm live right now. This is It to Focus Facebook Live and Instagram live Q&A. So where I usually answer questions about like natural alternative ADHD treatment options and by the way, I'm Anatai. I'm the author of the book Eat to Focus, which you can get either from my website or on Amazon.com. And usually during this section, which actually happens every Saturday, 10 o'clock, 10 a.m. Hawaii Standard Time. So depending on which part of the mainland, we just have daylight saving time. So I think we're like 3 hours behind LA, and then 5 or 6 hours. I don't quite recall from the Midwest, and I should know because my daughter's in Chicago. But shame on me. It's okay. Um. Anyway, so today instead of answering questions from inside the Facebook group, I decided to talk about um, a few underlying causes of ADHD. Okay, it looks better now. I'm looking at the numbers here on Facebook because they showed the time. I was like, I don't think I'd be on that for 58 minutes. Anyway, so today I was thinking that instead of answering questions from inside the Facebook group, I'm going to talk about like a few underlying causes of the ADHD because what I noticed is reading a lot of the comments and questions inside the group, what I notice is a lot of times when people try to avoid medication, so it's almost like everyone knows that if you have ADHD, the first choice is that medication, right? That's usually what your doctor recommends. But no one ever talks about anything else. And how the medication works is basically it manipulates the brain chemicals in your brain, and it focuses on or assuming that's only one cause to the ADHD um, to the root cause of the ADHD, or one way to treat ADHD, which is to boost the brain chemicals. So the idea behind medication is pretty much all ADHD medications, especially the stimulant ones, the way that they work is it raises the level of the focus chemical, the dopamine. So that's like to me, the medical or the medication to treat ADHD is kind of like a one trick pony. Like there, that's like the only trick that the medical side have to use. But on the functional side, like I talk about in my blog and also in my book, is that we need to look deeper. We need to dig deeper behind the ADHD symptoms rather than looking at ADHD as a label of a person or a child. We should look at the ADHD symptoms like lack of focus, hyperactivity, impulsivity, mood swings, and all of those as more like a symptoms, kind of like headache or when you have stomach ache. Why are you having a stomach ache or why are you having a headache? Because there are many underlying causes that could have those kind of symptoms. So that's kind of how I look at ADHD and how I come up with this whole Eat to Focus protocol. It's not trying to look at ADHD as just one diagnosis and one treatment kind of way. So there's still so basically, if you follow me for a while, you've heard me talk about the ADHD brain, leaky gut, and all those things, which I think we talk about a lot. But I want to talk about a few other things that will help you kind of have better understanding when it comes to looking for an alternative ADHD treatment. Because, like I said, what I see is when people try to avoid the ADHD medication route, then they go into the natural alternative route, which kind of like a Wild Wild West there. Did I say it right? Is like the natural alternative side of the ADHD treatment is like a Wild Wild West. Like anything goes, anything that is not medication, people try. But then what I see is that people just randomly try random stuff. It's kind of like throwing a bunch of spaghettis or like that game in the in the I don't know what you call that, the carnival where you just randomly throw balls at the target and then hopefully one of the ball will land in the hole. Some kind of like that way. So I kind of want to shed some light to explain what some underlying cause of the ADHD symptoms and how you can make some changes to that. So kind of give you some light so that way you kind of know where to go. So so okay, like I said, I'm not going to talk about the ADHD brain or the ADHD gut today because I talk about that all the time. You can go back to my of Facebook and look for a post, or you can go to natural alternative ADHD treatment.com. That's where my blog is, and you can search for ADHD brain or the keyword ADHD gut or leaky gut, and you'll find a lot of information on that. But I want to focus on something that is not commonly spoken about. So the number one, well, my background is a registered dietitian. Actually, more specifically, I'm a pediatric dietitian. So I specialize in children's nutrition, working with children who have very either picky eater or very complicated medical history, rare genetic disorders, and all those things. And the reason why I want to bring that up is because I work with a lot of kids, so I do get a lot of referrals from doctors about um, for kids with weird things. But what I notice is, or what I also get a lot of referrals to is parents requesting to have me help them with changing the kids' diet before trying medication. So um, unfortunately, those kind of referrals to me are usually driven by parents. Very, very seldom do doctors recommend that. Most doctor will just try push medication, and usually it's the parents who, with the gut feeling, knows that there's other options available. And from my experience, I've been doing this for like over 20 years now, and from my experience, sorry, weather is a little bit rough today, so um, okay, from my experience is that pretty much every one of my patients who I help change the diet to be better, to to be cleaner, and also matching their biochemistry or actually matching that body's um, tolerance based on the history. Um, Pretty much 100% of my patients see improvement. Like almost no one actually changed the diet and did not see any improvement. So I'm pretty confident about um, things that I talk about here, and there's a lot of research to support like some of the recommendations I have in my book and on my website. So, but that's another topic. But like I said, I'm not going to focus on like the gut health and the brain. I want to talk about food sensitivities and intolerances and environmental toxins. So I try to lump off those, and it's because they're all kind of related. So most of the time when we think of ADHD, automatically we think that something is wrong with the brain. It could be, but it could be not. But again, there are many different underlying causes. And even though I'm inside my book, I only talk about six of those underlying causes. There are way, 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 way more different kind of um, underlying causes as well. But but yeah, one of the ones that I talk about a lot and I see a lot is food sensitivity. Like I see kids with all kinds of symptoms coming to me, and doctors have no clue what's going on. And then after they see me, I realize that the child is actually sensitive to either the food itself or additives added to the food. And when we look at those kind of things, is that The way we have to look at food sensitivity is we often think that food sensitivity or allergies is something a physical manifestation. What most people do not realize is that a lot of times reaction to food or substances added to the food or things are around in our environment doesn't only cause physical manifestation, but it can also affect your mood and your attention and your focus. Like typically, most people when they think of like a food allergic reaction, they're thinking of something um, immediate, like someone's face starts swelling up, turning red, they have hard time breathing, their throat swells up, or they break out in full body rash. So those are the very common thing that people think about when it comes to food sensitivity. But what they don't realize is there's something, uh, or actually that's more what I refer to as food allergy. Because with that kind of reaction, when you eat something and see a reaction immediately, like within an hour or so, that's what we call, that's what I call, or most health professionals refer as a true allergy. The reason why it is called a true allergy is because it actually trigger an, an immune response. And this is IgE, which is the anti um, the immuno, immune globulin E that's being activated. So that's a true food allergy, true reaction, true allergic reaction. And that will be the reaction that will show positive on the blood test and the skin test. And then on the other hand, then you also have like some other allergies that's kind of subtle and you're not quite 100% sure. These are usually the ones where parents come to me and they're like, I think my child might be allergic to this, or I think my child reacts to this. So if you have that parent instinct that there's some food that your child is eating that might be causing some reaction, chances are you're pretty right, even though the blood test and the skin test all come back negative. So don't feel like you're crazy because, again, the blood test and the skin test have their limitations. And the limitations is the blood test and skin test only have a defined number of allergens that they're testing. So if your child is allergic or sensitive to something that is not tested in the blood test or the skin test, it is not going to show up. And also the other thing is some of the, so I mentioned about an allergic or immune response reaction versus intolerance. So blood tests and skin tests only look for actual immune reaction. That means that the immune system is actually activated. But what we're actually looking for in kids with ADHD or adult with ADHD, we're looking also for like what I would call something like a food intolerance or chemical reaction. So those are things that blood tests and skin tests will not test out positive, and that's where the frustration comes. Is parents will be like, all the blood tests and skin tests all negative, but I swear to God, every time my child have this or that, they react. They either break out in hives or like sometimes just more like behavioral reaction or get more irritable, more mean and angrier and things like that. So, so what are some of the things that will not get tested positive in the blood test or the skin test, but will be more of an intolerance? So a few of those will be things like the biggest two things will be dairy and gluten. So dairy product will be like anything like milk, cheese, yogurt, ice cream, anything that has milk in it. So usually it's the milk protein that's the problem. Some people might be sensitive to the milk sugar, which is the lactose. Um, and this is another thing. Lactose intolerance is not an allergy. It is an intolerance. More the way to look at it is more like a um, chemical reaction or chemical irritation. So basically, what happened is lactose, even though it's a sugar, our body needs a very specific enzymes to break up that sugar and process it and actually use it But in some people, especially in adult, as we get older, the amount of lactase, the enzymes that break down lactose, get less and less because we're not a baby anymore and we don't rely on drinking milk. So that function of the lactose or lactase decreases. So um, yeah, so lactose intolerance, it is an intolerance, not an allergic reaction. So it doesn't show up in blood tests or skin tests. And then there are other things that are added to the food. So a lot of you starting this natural ADHD alternative treatment process is that you probably start doing a very clean diet, cleaning out all the processed foods. And the reason why that works is because in processed food, so processed food are things that comes out from a factory. So I call those factory food. So going through the factory process, the food kind of like got altered so many times to the fact that it doesn't even look like real food anymore, and to the point that your body doesn't even know how to process it. So, with that in mind, knowing that anytime you get processed food in your system, your body cannot process it because your body cannot recognize it anymore. And then the other thing is that there's so much chemicals added to the food that you just don't know what it does. But all these food manufacturers, including the government agency who puts out all these nutrition and health recommendations every couple of years, they all telling you that all these food chemicals, as long as they don't provide any calories, they tell you that it is safe to consume. Things like artificial sweeteners like Splenda, NutraSweets, Equal, and Sweet and Low. Did I mention that? Yeah, all of those, they call it healthy um, ingredients. I was like, that's chemicals. How could that be healthy? Um, and then preservative, there's a lot of preservative added to the food. The preservative is not added there for your benefit. The preservative is added to the food so that way the food can stay on the shelf for as long as possible. If you go to the store, or maybe just go in your kitchen right now, pull up, pick up one box of something that you have in your pantry. Look at the the best by date or the expiration date. Some food have like an expiration date for 2 years. Just think of it this way. If the food can stay out for 2 years, even bugs and bacteria won't eat it. Do you really think that your digestion can handle that kind of food, right? So that's kind of one first clue that you know when the food can be kept out for that long. Chances is you can break it down either with your human intestine and in your gut. And that's one of the things that we need to also remember that um, our intestine and our digestive system is very delicate. It's not a garbage disposal that food goes in, get ground up, and then we get the nutrients and then poop comes out. That's not how the digestive system works. Everything that we eat, every carbohydrate, protein, and fatty acid have very specific enzymes that breaks down each type of those nutrients. So it is not like a mechanical process of digestion. It's a very delicate biochemical and enzymatic process. So when you eat food that our digestion cannot process, it becomes a burden for the body to handle. So that's something to think about and remember when it comes to eating. And where was I? So that's the digestion, and then the other thing. Actually, I kind of digress away from dairy. So going back to dairy, so I talk about um, the two most common food intolerance and sensitivity in kids with ADHD is dairy and gluten. And even if your kids have autism, those are the two main things because that's kind of where I started my research on is I used to see a lot of kids with autism and pretty much a lot of parents will come back, put the kids on the casein-free and gluten-free diet and they all come back with wonderful results. And like I said, I've been working with kids with special needs for the last 20 years. I've seen so many success stories and that's why I'm here talking about it, spreading that information. Hopefully, we can help more people in the world and live a better life. So, anyway, so dairy. So, I think I kind of started with like the additives and things added to dairy. The other thing with dairy product is the protein in the milk, the milk protein. So even though we just say milk protein, there are actually over 20 different types of milk protein. But the ones that is most damaging to the guts is the casein. Milk protein in general is just really, really difficult for the human intestine to digest because dairy or cow's milk is actually not made for human consumption. It's more designed for baby cows, so it works better for the baby's cow's intestine. And we all know cows have four stomach, and we only have one. So just another clue right there why we should avoid milk as much as possible. But I'm not saying you should not eat milk because I do eat milk too, but I use milk more as um, a flavorings to the food, but not a main component of it. So so that's one thing. Milk protein is difficult for the human digestions to break down. And then knowing that that is difficult to break down, meaning that a lot of the milk protein might not be broken down perfectly to a form that we can use. So with that means that some of the partially indigested milk protein can turn into some toxic substance in the intestine or in the body. And one of the things that it can end up is called casomorphin. So, well, if you hear the word, the last part of the word is morphine. So basically, it's like a milk form of morphine, which is similar to the drug morphine, which actually attached to the same brain chemical or brain receptor that other opioids and morphine attaches to. And that's why you always hear people say, I love cheese. I hear that every day. Just yesterday, my patient told me that. I was like, yep, there's a very good reason why you love cheese. And there's also good reason why they put cheese in everything, like the cheeseburger, like you go to a restaurant, especially fast food restaurant, you'll see like all these things loaded with cheese in it. And there's a reason why, because they know cheese is addicting. So they put it in everything so you can keep coming back. And then the other thing about um, milk or dairy, or mostly milk, is that even though we think that milk seems like a very natural and healthy item, because isn't it like a great source of calcium? So number one thing is we need to be very careful about great source of calcium because a lot of I've seen a lot of kids with iron deficiency, and it's not because they're not eating enough iron. No, I've seen a lot of kids with iron deficiency, and most of the time the reason is not because they're not eating enough iron food. A lot of times it's because they're eating or drinking too much milk. One of the things that most people do not know and most doctors do not advocate enough is that if you drink too much milk, which you know is a very good source of calcium, but all that extra calcium is actually blocking the body from absorbing iron. So most little kids don't really have a huge load of iron in their body after they're born. We only have about 6 months worth of iron storage in our body from the time we're born until 6 months of age. So that means that between 6 months and 12 months, we rely on an outside source for iron. So if your child is drinking a lot of milk at like 12 months, there might be a chance that there's iron deficiency. And iron deficiency is actually one of the nutrient common nutrient deficiency in children with ADHD. But going back to milk. So milk, one thing is the allergy part, allergy or sensitivity to the milk protein. Part of it is because it's difficult to digest. The other part is the calcium in it that could block the iron, which is needed in a lot of brain chemicals. And there's correlation between iron deficiency and decrease in school performance and, and intelligence. And then the other part with milk is the hormones in the milk. So we often think that milk is so healthy, right? But then but then the way that milk is actually manufactured nowadays, and I actually use the word manufacturer because even though it comes naturally from a cow, but the whole process is all jacked up and hijacked and all screwed up, messed up, whatever. So normally a cow kind of like get pregnant, have the baby cows, and then nurse the baby cow for I don't know, a couple of months until baby cows all grown up, and then maybe another year or so the cows get pregnant again. Like I don't really know all of this, but I'm pretty sure cows don't get pregnant every single year, right? Just like humans, we don't get pregnant every single year. Only a few human does that, but that's not the norm. So what happened is in the dairy farm is that they have all the cows, the they get the mommy cows pregnant almost continuously. So there's no break in between pregnancy. And what happened is that so the baby cow's milk or the breast milk for the baby cows already have naturally growth hormone in it to help the baby cow grow really fast, right? So that's one thing. So that's one hormone in there. And then on top of that, with that frequent pregnancy, so every time the cows gave birth, then they get pregnant again. So all that extra pregnancy hormone is ended up in the cow's milk as well. So when you're drinking cow's milk, you're not only just getting the growth hormone that is meant for the baby cows, but you're also getting the pregnancy hormone from the mommy cows as well, which naturally is either a very low level or not existent in there. But because the cows are made to be pregnant every year, now you have that all these extra hormones in there, and and you might think, oh, but it's cows' hormones, right? It doesn't apply to human. Um, the way to think about food and hormone is that everything that you put in your body is a chemical signal to your body. If your body can use it, great. Your body will use it and do some good with it. But if your body cannot use it, it treat it as a toxin, as a poison, as garbage that you have to take out. It's kind of like your kids or your dogs went outside and play in the mud and then come home with all this mud on the floor and you have to take time to clean up. So that's kind of how you think of when you're eating something that is processed or manipulated by companies. So anything that your body cannot process or use pretty much is garbage to your body. So it takes resources and effort away from doing other stuff to try to clean up the mess in there. So that's cow's milk. And then the other thing I mentioned is the gluten. So I feel like I'm talking very fast. Okay, gluten and ADHD. So I know a lot of people, especially a lot of my colleagues, like regular registered dietitian who's trained in the conventional way, which I was too, but that's my other story to tell. But a lot of dietitian doctors don't believe that food can cause any reaction, but I am gonna say it does. So, and I see that a lot, and it's unfortunate that our medical system teaches us that anything that food manufacturer makes, anything that looks like food, is considered food and goes in the body. Every time I see my colleagues drinking diet soda, and I just cringe. It's like, oh my god, my colleagues drinking diet soda. That means that they're telling everyone else to drink that, and I was like, that's so damaging to the body. But anyway, sorry, I digressed. Okay, but back to gluten. So gluten do a gluten is a type of protein that is in wheat and in I think wheat, rye, and barley. Those are the main three, but there's actually a lot more. If you go to select.org, I think it's org. Yeah, just try select.org. That's the Select Foundation, and you can actually download a long list. I think that list is something like 20 pages or so of all the gluten containing food. It's amazing. It's like gluten is in a lot of stuff. But anyway, I don't expect you to go on a super clean gluten diet where you just avoid every single bit of gluten in it. And the thing is, if you want to try out the gluten-free and dairy-free diet, all you need to do is avoid the very obvious dairy product and the obvious gluten product. You don't have to read all the labels and figure out if there's hidden stuff in it. Because if you just avoid all of the obvious ones, like the milk, like drinking cups of milk, eating cheese, and eating yogurt and ice cream, and then replacing the bread and cookies, crackers, all those things that have gluten in it, you see significant improvement. You don't even have to actually look at all the labels to look for hidden ones. That will only be required if you have tried re- removing all those food and still not see any improvement. But anyway, so with gluten is that the gluten is not so much of an allergic reaction, even if well, unless you have celiac disease, that's kind of like an allergic reaction. The way I always tell my patient who have celiac disease is look look at it as an allergic reaction to the wheat product and the gluten product. Then that way you'll be more likely to follow the diet and all of that. Because when you have celiac disease, the level of um, attention you need to put on gluten product is significantly a lot more intense than if you just have an intolerance. Because usually with an intolerance means that you can tolerate a little bit of it, but if you just keep putting more and more in, it will the symptoms will become more severe. So again, with some of the gluten sensitivity or the intolerance is that you might not actually have a physical manifestation. Sometimes, like most people will have something like a stomach pain, some people have diarrhea or constipation, you might even have rash, but other more behavioral symptoms will be like lack of focus, brain fog, and what's the other thing? Anxiety or even depression can actually be caused by a gluten intolerance. And again, intolerance means that it's more like a chemical reaction or irritation. It doesn't show up in blood tests or skin tests. So the only way, only best way we call the gold standard of checking for any food intolerance is actually keeping a food log, a journal, writing down what you eat, and then also the reaction, any kind of reaction that you have, like any kind of physical reaction like stomach pain, vomiting, diarrhea, constipation, and then also behavioral reaction like if you wake up feeling anxious that day or you wake up with racing thoughts and things like that. And actually, like I personally, I also have gluten intolerance, and took me at least 2 to 5 years of denial before I finally accept that and like just stay away from gluten and most bread product. And I think I'm also sensitive to um, what's that, rice as well. Yes, I'm Asian and I'm sensitive to rice too. So, but that doesn't mean that I don't eat those completely. I just have to be very aware that when I do eat rice or eat anything with gluten in it, I eat a very small amount just for the taste of it. Because sometimes I do miss it. But but anyway, that's me. So yeah, so dairy and gluten are the two biggest things that I will recommend to avoid. Like if you want to try out this whole ADHD dieting thing, and then there are other food that I recommend to avoid in my book for the elimination clean start portion of it is things like eggs. So it's all your very basic or the very common food allergies. So eggs, nuts, seafood, specifically shellfish, and let me think if oh, and soy. So soy protein, a lot of people who go on a milk or dairy-free diet often go to soy as an alternative, but like in my practice at my work in the clinic, even the endocrinologist, the pediatric endocrinologist I work with very closely, we do not recommend soy at all. Like you wouldn't even see soy formula in my clinic because if a child is allergic to milk, like they actually show blood in the poop. Like usually we don't use soy products at all. because soy protein and milk protein are very similar. So about 60% of kids who are allergic to milk protein is actually allergic to soy protein as well. So we never use any soy formula or soy milk or things like that. That's one of the reasons. Second reason why we don't use soy is because of the soy estrogen in it. And I know there's a lot of controversy about whether the soy estrogen does affect the humans, and it does. If you talk to any oncologists or cancer doctors, they all recommend their cancer patients, especially breast cancer patients, to avoid soy protein and soy product as much as possible. Like, it's one thing that you hear all these doctors going back and forth, like fighting, like, should you avoid soy or not? It's like, the thing is, to me, it's all more common sense. Study is great out there to kind of point us in the right direction, but it's not the absolute. And the thing is, if I have breast cancer and knowing that there is controversy between soy estrogen with like inducing breast cancer, I'll be like, I don't care about what your study says that is safe, but you know what? Just to be safe, I'm going to avoid it. So that's something to think about. And the other reason why I personally advocate against soy protein, not like I said, it's a controversy. You ask one doctor, they says it's okay, another doctor says no. But this is from my own personal experience. So when my daughter was little, I suspect that cow's milk is upsetting her stomach because she's just like any other child out there is addicted to milk. So she'll chuck down milk all day long, like 3 glasses a day. But when she have that much milk, she always complains that her belly hurts and her bottom will be all red and raw. So I just like a conventionally trained dietitian. That was over 10 years ago. So I switched her to soy milk. And when she started drinking a lot of soy milk, I noticed something's weird's happening. She was only 9 years old and she was growing breasts. And I freaked out. I was like, oh my God, that's not supposed to happen at 9 years old. So I stopped the soy milk completely. And then her breast shrank back to normal 9-year-old breast, like flat. So that's my own personal experience, and that's the reason why I do not advocate soy milk at all. You can eat edamame beans, you can drink soy milk, a glass here and there, like a few times a week, but not chucking down 2, 3 cups of soy milk a day. That's definitely not gonna happen again in my household. So yeah, that's milk protein. I don't know where I started, but oh yeah, so dairy and gluten. So that's the sensitivity. Oh yeah, yeah. Okay, now I remember where I was. So common food allergies. So soy, eggs, nuts, shellfish, and then gluten and dairy. And then peanuts. Peanuts is actually a legume, not so much nuts. But usually, if you're allergic to peanuts or any kind of tree nuts, you just avoid everything because they're all like cross contaminated. So yeah, so that's what the full on eat to focus the elimination clean start part is. You eliminate all the common food sensitivity thing, but in general, I would say if you just starting want to try it out, take out at least the dairy and the gluten. If you don't see much improvement, then you can try remove the other things as well. And a lot of times people think that the elimination diet is very restrictive. It's restrictive in a sense that you have limited food choice, but nutritionally it is adequate. Especially you'll be eating most of your food from animal protein, some seeds, and what's the other thing? Seeds and nuts. No, mostly seeds. Seeds and animal protein, and fruits and vegetables, and you can survive on that because that's what human has been surviving on before manufacturing and farming happens. So, and and then healthy fats as well. So let me see if I missed anything. I, I think I kind of bounced between different topics, but it's okay. Like, just hang out here with me and you'll learn a lot. Okay, so that's the food sensitivity. Um, Oh, just one last note. So the reason why I want, like in the elimination clean start, that's actually a temporary diet. It is not a permanent diet that you stay on forever. It's like a it's more of a process of elimination. So you eliminate those food for at least couple 1, 2 to 3 months, depending on how fast your symptoms improve. And then once you see your symptoms get better, you can put some of those food back one at a time. And you might notice that some of the food you still have problem with, like and and the other part of it is that you kind of have to learn to listen to your body, listen to your child, and observe for any reaction and things like that, because it's only me. I'm just here to guide you with what I know, but you ultimately is the guru and is the person who knows your body best, who knows your child the best. So it doesn't matter what I tell you what to do or not, but I'm just here to be your guide, to be your cheerleader, to help you along the way. But so yeah, so after you stay on that elimination clean start diet, and when most of the symptoms get better, you can put one of the food back at a time. If the food you still notice there's reaction, then probably you should try to avoid it as much as possible. But in the future, if you ever have the chance to eat those food again, just know that when you eat this food, you do react to it. So knowing the consequences also help, because one of the worst thing that you can do to you and your child is totally restricting something to a point that you actually will binge on it later. But that's another topic. But basically, knowing that certain food will cause more reaction, and just kind of recognize that not you don't your body doesn't like all the food. And even though someone might say, oh yeah, eggs is good for you or beans is good for you, but it doesn't sit well with you, it is not good for you. Okay, we need to put some of that self responsibility back in our own care, not just try to listen to all these health guru and nutrition guru out there. Even like me, I'm telling you that all these things to avoid, but maybe you don't have any reaction to it either. So, but it is an experiment that you do. And again, I'm here to guide you. I'm not here to tell you what to do. Okay. So the next thing, okay, I might actually have time only for one more thing to talk about is nutrient deficiency. So I mentioned about iron deficiency. So there's many kids with ADHD tends to have more nutrient deficiency, and there's many different reasons why. And I think in my book I did talk about being premature. If your child is born premature, that puts your child at high risk for nutrient deficiency and also ADHD diagnosis. And then one of the other causes that I was going to talk about, I'll probably try to talk about this really quickly and briefly, is actually childhood trauma. So I think a couple of weeks ago, I actually have a post that talks about trauma, childhood trauma. When we often think about trauma, we're thinking of something very traumatic, things like physical abuse or emotional abuse or sexual abuse or witnessing something very traumatic happening, those kind of trauma. But what we've learned is that a lot of times the childhood trauma that we experience is something very subtle, something simple as like not getting not being loved by the parents, not getting the recognition, or like not feeling love, not being connected, or parents who you grow in a household where your feelings are not validated, like you cry and then your parents just tell you stop crying, I'll give you a reason, or else I'll give you a reason and cry. So your feelings, you grew up learning to hide your feelings and ignore your feelings. Or other type of childhood trauma will be like um, foster care or being put up for adoption, because children who go from household to household, that's another type of trauma, because being passed from people to people, not being in a stable environment is actually a trauma response or cause trauma reaction, because the child growing up not knowing who they're still who they can rely on, and on that constant feeling of not being careful, the constant feeling of uncertainty, that can be a childhood trauma as well. And you can actually read all those things about childhood trauma from the book What Happened to You. Is actually a book written by Oprah Winfrey and the child psychologist, Dr. Perry, and I forgot his first name. So yeah, it's all of those are documented in that book. It's called What Happened to You. So that's also one thing too that I start recognizing in my practice since I start studying to become a hypnotherapist, is learning about psychology behind a lot of our reaction and the way we behave. Is like I see a lot of kids with ADHD also have anxiety and depression. And generally speaking, anxiety is the sense of worrying about the future, what's going to happen, what could happen. So we make up all these stories in our head to scare ourselves. That's anxiety. Then depression is usually related to something from the past, something that happens to the past that make us feel bad, make us turn inward, try kind of like um, avoiding the outside, turn everything inward and roll into a ball and just like I don't want to interact with the outside. So if you think about like what anxiety and depression is, if you're constantly worried about what's going to happen to you, constantly in a state of fear, then there's no way you can stay focused and remember things because your body is in a stress state. So that's what the trauma response is, and the anxiety and depression with ADHD. So that's something to also think about because all I see is that when people try to look at ADHD treatment, they're just focusing on like a physical thing that they can take or do to just get rid of that focus or that lack of focus, impulsivity. They just want kids to calm down. But I think as parents, as someone dealing with the condition, and also as healthcare providers, we need to look a little bit deeper into why is the child having ADHD symptoms, is also having anxiety and depression. Especially in my population, I work in a military hospital, so that means that I see kids and families who move constantly every 2 3 hours. So I see a lot of kids with like adjustment disorder, anxiety, and depression. And probably part of it is just the fact that they're moved every so many years, so they're forced to be put in a new environment, have to make new friends again, learn to interact differently, go from one culture to another culture. All of that adjustment can be significant trauma to the child as well. And some child just cope with things better than others, just like some adult cope with stress better than others. So that's something that we also have to look into, and that's something that I pay attention to as well. Then going back to the nutrient deficiency with kids with ADHD, and this is kind of like my cup of tea because I'm a dietitian and specialize in children's nutrition. So the few nutrients that are commonly deficient in kids with ADHD is um, iron, zinc, magnesium, and then omega-3 fatty acid and the vitamin Bs. So these are usually the few vitamins that I always started with in kids who come to see me with ADHD. Definitely omega-3 fatty acid is usually the first one that I start. Magnesium, zinc, those are other ones that I do. And then with iron deficiency, I will only start iron deficiency after looking at the blood test, not just a regular CBC itself. I look at the whole CBC panel, and also the iron profile as well, because CBC doesn't give me much information. Um, but you can always ask your doctor to get those checked. So CBC plus the iron profile or iron studies. So you look at the the iron circulating in the blood and the storage iron as well, and then also the total iron binding capacity and things like that. And yeah, so the omega-3 fatty acid. So out of all the supplements that is beneficial for helping with ADHD symptoms, omega-3 fatty acid is one of the ones that is most studied for the ADHD. So that I have confidence with prescribing that all the time because everyone always come back and say the child is a lot more calm, more focused with the omega-3 fatty acid. And one other things that most people do not realize is that our brain, about 8 to 10% of our brain tissue is actually omega-3 fatty acids. So that's another reason why we want kids to have that, because part of the ADHD brain is that it is smaller and it's a little bit behind. So it goes along with one of the cause of like being premature, right? So if your child is born premature, and definition of prematurity is born before 37 weeks of gestation. So if your child didn't have enough time in your body to fully develop, some of the things that's supposed to develop in you might not happen. So that's one way how a premature baby can have a high risk of developing ADHD. And again, ADHD is just a label of symptoms. So, and then what's the other thing? Magnesium and zinc and iron, these are minerals that tends to be low in kids with ADHD is because pretty much most of the kids that I see with ADHD tends to eat a very poor diet, um, especially the picky eaters who pretty much eat chicken nuggets, french fries, pizza, hot dogs every day. If you look at those food, we don't see any of those food, any food that has a significant source of iron, zinc, or magnesium. Iron, zinc, and magnesium, you're gonna find those food more in like real animal protein, fruits, and vegetables. So if your kids is a very picky eaters and eat a lot of that processed kids food, chances is your kids might be low on minerals that I mentioned, like the magnesium, zinc, and iron. Um, and then the other thing is the B vitamins. So the B vitamins is not so much of a deficiency, but more so an increased needs. So the B vitamins, especially with kids who have a lot of stress and anxiety kind of symptoms, and then also eating a very poorly, a very processed food diet tends to use up more vitamin B's because vitamin B's have multiple different kind of jobs. So vitamin B, one of the job is that it pushes the food into the mitochondria and turns that into energy for the body to use. And then the other job that is does is somewhat associated with the stress hormones. So if you have a lot of stress in your life, like not sleeping enough, people mean to you at work, you have a mean boss, or just constantly in a stress state, stress actually increase your vitamin B usage. So when you have a lot of stress, using a vitamin B complex supplement is always a good idea just to replenish that B. And then also the vitamin B, specifically the B6 and the B12 is something that is needed to help with making some of the brain chemicals that is kind of low in the ADHD brain. So that's the benefit. And usually I don't recommend using an individual vitamin B6 or individual vitamin B12. And the reason why is because there are 9 different vitamin Bs and you want to have all of them. Even though your need as someone with ADHD or your child with ADHD needs is higher, there is a supplement that is actually have a significantly higher dose of vitamin Bs in it, and that's what I usually recommend. And I'll put the link. And actually, after um, this live thing finished, I'll put in the things that I recommend during this recording, so you have a reference to go to. And yeah, so the nutrients deficiency will be like omega-3 fatty acids, zinc, iron, and the vitamin Bs. Did I miss any? And then the other thing is the gut health that I didn't talk about, but probiotics will help as well. So those will be some of the vitamins to look into to start with the natural alternative ADHD treatment journey. And then, and yeah, those are the few things that I talked about today, summarizing what I talk about today. Um, the I think I've said five underlying causes of ADHD that no one talks about. So let me see. I talk about food sensitivities or some kind of chemical sensitivities to to food chemicals in the food, and then nutrient deficiency, I talk about childhood trauma. Maybe I don't have all five, but anyway, those are a few of the underlying causes that no one talks about. But the ones that people talk about a lot, or I talk about a lot, is um, the ADHD brain being a little bit different, smaller, a little bit delayed. When I say delay, it doesn't mean mental retardation, that's different, or delay in intelligence. Kids with ADHD are super, super smart, but delay in a sense that it's gonna happen later, kind of like a speech delay. Like my daughter, she didn't speak her first word until 18 months. That's called delay. Nothing wrong with her intelligence. She's super smart. She graduated from one of Hawaii's toughest high school with honor, and she got a merit scholarship attending Loyola University right now. And actually, she's graduating in May. That's just so wonderful. So just reminding you, kids with ADHD have no problem with the intelligence. Their problem is the focus, and we can give them the nurturing, the environment, the food, the love, and the things that children need that will survive and thrive and be a superhuman beings. Okay, so anyway, that's it for today. So if you're on Instagram and you want to kind of hang out with us, so hop over to the Facebook group. Is I think the group is still called Natural Alternative ADHD Treatment Group. So in there, we're like, I think last I looked, we have 14,000 members now. So it's a super strong, growing group. You'll get a lot of support and love in there. And if you're on Facebook, you can also follow me on Instagram at Eat to Focus, and I posting up there all the time. But anyway, and I also have my blog and also my book. So the book you can go to my website or somewhere. Instagram has a link in it, and Facebook should have a link, and you can get the book and get all the information that I talk about all the time, all in the book, and you can just read it in one sitting and just learn everything. But anyway, so this happens every Saturday, so that means that I'm gonna see you guys next Saturday again. And last week I have some very important things that I need to attend to, so I skipped 1 week last week. But I'm so happy to be back talking to all of you guys. So that's it for today, and all of you have a very wonderful Saturday, or maybe it's Sunday in some, depending on where you are in the world. But thank you so much for being here today. I love you all. Bye.